Everybody, I'm Dr. Amy Kanata and this is Ashley Bratko, and we're here today to talk to you about what to expect for weeks 8 through 12 as you rehab from your total hip replacement. Ashley, what are some goals people can expect the next few weeks?
For weeks 8 through 12, we're really looking at strengthening. You don't want to lose that range of motion that we talked about in our last video, working on that stretching, that's still important, but really we want to get that strength back.
So what I hear you saying is less manual therapy, more activity.
More activity, 100%.
Right. And as with anything, please check with your surgeon before starting these or any other exercises to make sure that you're safe and ready to go. All right, for our first exercise, we're going to be talking about lateral band walks. For this exercise, you're actually going to need some exercise bands around your feet. But in order to do this exercise properly, you have to start out with really great posture. So one of the things we want is to make sure you're not slouched over, you've got a nice flat back, your back is not arched too much, and you're pulling your belly button in towards your spine or your belt buckle in towards your belly button. So in order to kind of demonstrate that, we're going to show you exactly what not to do. We don't want your back arched too much, and we don't want you slouched over. So we want your back nice and flat, your posture nice and upright before you start this exercise, okay? Okay, so for this next exercise, you're gonna wanna make sure that you have a slight bend in your knee. You don't want your knees going over the front of your toes. You wanna keep your feet nice and straight. You don't want them turned in or out. And you're just gonna do 3 to 5 steps to each side and back. All right, for our next exercise, we're gonna demonstrate what's called a single leg balanced stance. Now this one should be done as much as you can without the assistance of a walker or without this assistance of a countertop. But if you need that extra assistance, you can always lean on a chair or your countertop. So for this exercise, we're going to be pretending that the right hip is the one that's been replaced. So you're gonna be using that one to stand on, left knee up. Now the most important part of this exercise is again engaging your core, making sure that that belly button is drawn in towards your spine or that belt buckle's drawn in towards your belly button. And you're gonna hold that to the count of 10 and then go ahead and relax that down. So Ashley, can you demonstrate what not to do with your pelvis? Yeah, you don't want that hip hiking out like that. You wanna keep the center of gravity nice and squeezed. All right, so for the next exercise, we're gonna demonstrate for you something called step dips. So this one, you really you'd need some sort of step. Ashley, what would people do if they don't have a step at home?
If they don't have a step or stairs, if you can find any sort of curb outside in the backyard with something that they can hold on to, they can do that. Otherwise, they can kind of do just a hip hike where they're standing flat on the ground and just sort of lifting that hip. That's still gonna build the muscle, not as well, but they're still working on it.
Okay, great.
And again, keeping those hips as level as possible so that there's not that drop.
That's great. And then how many reps are they gonna be doing?
I would say like start with 2 sets of 10. If that starts feeling easy, go to 2 sets of 15. Always wanting to feel that burn and push towards that end and get about 2 to 3 more after fatigue.
Perfect, great. All right, this exercise is actually kind of a classic. The classic Clam, you can do it even if you haven't had your hip replaced. I think it's a really great exercise all around to really work those glute muscles. So Ashley's gonna demonstrate. Before we get started with the demonstration on how to do these, I wanna point out that you wanna make sure that your body, your shoulders and your spine are kind of all in one alignment. You don't want any flexion at your hip. You want to start out with a nice straight line to get started with this exercise, okay? So it's really, really easy. Classic Clam maneuver. You're just going to move your legs like a clam. You're going to do 2 sets of 10 reps. Make sure you feel the burn. If you want to add an extra 2 at the end, feel free to do that. Now this can be done a couple ways. You can do it classic Clam, keeping your feet together as you do it. And then go ahead, Ashley, and just demonstrate another way to do this.
Okay. Position 2 would be keeping the knees together and bringing up that foot.
The foot.
Yep, and you can move the band down if you wanted to get more at the ankle if you needed more resistance there. And another position would be to lift and do them simultaneously together.
All right, so the last part of this exercise that makes it a little more difficult is actually giving your hip a little abduction with some internal and external rotation of your foot. So this is really going to work those gluteal muscles that are on the side, the glute medius and minimus, and really strengthen that area. And again, you can do these without the bands. They're definitely challenging enough without the bands. The next exercise is actually one of the most important functional to your actual life, is getting in and out of a chair. Like it seems so simple, but it's such an important part of life, and it's something a lot of people actually can't do very well, including myself. No. So we're going to show you the last exercise, which is sitting to standing, which is really going to not only work your hip muscles, but also your core and your glute muscles. So it's a really great, basic, kind of classic exercise. So I'm going to have Ashley demonstrate. Really easy. Awesome.
And then when it's easy to get out of the chair, we can move that to a squat where they just tap.
You just tap your
And
butt
come right back up.
Come right back up.
So
And then how many times are they going to want to do this, Ashley?
again, just like all the other ones we've shown, I would start 2 sets of 10. If that starts feeling easy, up it from there. Go to 2 sets of 15, 2 of 20, getting those 2 to 3 extra reps once you hit fatigue. So just another reminder with this, with any of these exercises, we don't want to have any pain with it. Muscle soreness is okay, you should have muscle soreness, but we don't want to have actual pain. So if you are having pain, discontinue doing them and consult with your surgeon first.
Thank you so much for watching. We hope you found this to be very helpful. And for more information, please visit hipreplacement.info.